Will AI make surgeons obsolete? A profound anxiety simmers within the halls of academia and the minds of aspiring healers. In a world where artificial intelligence can diagnose diseases from medical images with superhuman accuracy and robotic arms execute precise sutures without tremor, does the arduous decade-long journey of medical school, particularly for the surgeon, render itself a futile pilgrimage? This question strikes at the heart of our trust in human expertise, too. However, this fear, while understandable, is born from a fundamental misconception. In this TechMind 999 deep dive, we explore the future perspective of role of AI and the existence of medical schools. The imminent future of medicine is not one of replacement, but of radical collaboration. Going to medical school is not becoming pointless. Rather, its purpose is evolving from creating solitary experts to forging augmented healers. Physicians who synergize irreplaceable human capabilities with the formidable analytical power of AI. The surgeon of tomorrow will not be supplanted by a machine, but will become its essential partner, wielding technology to achieve outcomes neither could alone, ensuring that the call to medicine remains not only relevant, but more vital than ever. The incontestable strengths of AI and robotics. To dismiss the transformative potential of AI in medicine is to ignore reality. Its advantages in specific domains are foundational and will irrevocably alter the clinical landscape. First, AI possesses superhuman perception and pattern recognition. Trained on datasets encompassing millions of radiology scans, pathology slides, and genomic sequences, algorithms can detect subtleties invisible to the human eye, faint pixel signaling earlier stage cancer, or a rare phenotypic marker, free from the fatigue that clouds human judgment after a long shift. Second, surgical robotics offer unwavering precision and stability. They filter out physiological tremor, can operate at a sub-millimeter scale beyond the physical limits of human dexterity, and hold positions indefinitely. For standardized repetitive procedures, their technical fidelity is unmatched. Third, AI enables holistic data synthesis at impossible speeds. It can instantly cross-reference a patient's real-time vitals with their full medical history, genetic predispositions, and global outcome data from billions of similar cases, generating predictive insights and personalized surgical plans in moments. These capabilities will rightly make AI the ultimate diagnostic partner and a peerless tool for the technical execution of defined tasks, setting a new standard for certain aspects of care, the irreducible core of human medicine. Yet, to reduce medicine, and especially surgery, to a series of pattern recognition and technical tasks is to catastrophically misunderstand its essence. Medicine is applied biology, and biology is inherently messy, unpredictable, and deeply contextual. This is where the human physician remains, not just relevant, but sovereign. Contextual judgment and improvisation are paramount. An AI operates on probabilistic models trained on historical data. Bird. What occurs when a surgeon encounters the unexpected and anomalous artery, dense adhesions from unknown prior inflammation, or a tumor with ambiguous margins? Surgery is a dynamic, adaptive art form, requiring real-time decisions that blend experience, intuition, and a deep understanding of physiological principles. This is improvisation in a high-stakes environment, a capability beyond any current or foreseeable narrow AI. Furthermore, the surgeon-patient covenant, built on trust and empathy, is non-negotiable. Selling is a psychological as well as a physical process. A patient's consent, compliance, and even physiological response are influenced by the human connection formed with a physician who listens, explains, and instills confidence. Would one, on the eve of a life-altering operation, prefer a coldly optimal recommendation from an interface, or the calm, assured presence of a fellow human who says, "I will take care of you"? This relational foundation cannot be coded. Additionally, the physician provides holistic integration, weighing not just the disease, but the person. Is the aggressive procedure with a difficult recovery right for the frail octogenarian? What are the life goals of the young athlete? A human synthesizes social context, personal values, and quality of life considerations into the clinical equation. Finally, the surgeon bears ultimate responsibility and leadership. The operating room is a complex human ecosystem. When crises erupt, leadership, communication, and the moral burden of decision-making fall upon the human in charge. This confluence of judgment, empathy, ethics, and responsibility constitutes the indomitable human edge. The synergistic future. The AI-augmented surgeon. The true destiny of medicine lies not in a duel between these lists of strengths, but in their purposeful fusion. The future belongs to the AI-augmented surgeon, a cyborg conductor for whom intelligent systems are the most powerful instruments ever conceived. Imagine this near-future scenario. In the diagnostic phase, an AI pre-scans a patient's data, highlighting a 97% probability of a complex appendiceal tumor and suggesting an optimized surgical approach. The surgeon, using this analysis, engages the patient in a discussion, adjusts the plan to align with the patient's recovery priorities, and uses a virtual reality model to walk through the patient's unique anatomy. In the operating theater, the surgeon works through a robotic interface. Augmented reality glasses overlay critical anatomical landmarks and blood vessels in glowing outlines. Real-time AI analytics monitor tissue perfusion, whispering a warning of potential ischemia before it is clinically apparent. When an unexpected vascular anomaly arises, the AI instantly references a vast morphological database to suggest control strategies. But the surgeon's experienced hand and judgment execute the final life-saving maneuver. In this partnership, the division of labor becomes clear. The AI manages the volume of data, superhuman perception, and predictive analytics. The human contributes contextual judgment, adaptive improvisation, empathic communication, and bears the weight of responsibility. The result is not a diminished physician, but a transcendent one. The AI-augmented surgeon will achieve precision, personalization, and outcomes that would be deemed miraculous by today's standards, while an unaugmented practitioner relying solely on historical methods may falter. The healer who masters this symbiosis will be more capable than any in history. Therefore, the mandate for the aspiring physician is not to abandon the path, but to embrace its evolution. Medical school is not pointless. Its focus must shift. The next generation must cultivate the irreplaceably human skills with renewed vigor, deepening their capacity for ethical reasoning, complex communication, and holistic judgment, while simultaneously becoming technologically bilingual. They must approach AI not as a rival, but as a core component of their future toolkit, understanding its capabilities, its biases, and its limitations. The risk for future doctors is not replacement by machines, but irrelevance for those who refuse to adapt. In conclusion, the narrative is not one of obsolescence, but of augmentation. The timeless calling to heal, guided by empathy and ethics, will now be amplified by the most powerful intelligence humanity has engineered. This partnership promises a future where medicine transcends its current limits, ensuring that the human heart and hand, empowered by artificial intelligence, remain at the center of the sacred work of healing. If you enjoy deep yet easy explanations, critical thinking, and meaningful discussions about the future of humanity and innovation, this channel is for you. Subscribe to TechMind 999 and stay connected with the ideas shaping tomorrow.